My name is Matthew Mingrone. I'm a facial plastic and reconstructive surgeon, and I practice in Palo Alto, California. We offer everything, both surgical and non-surgical treatments for rejuvenation, primarily of the face. Our focus is on the face, but we offer other procedures such as hair removal and skin rejuvenations to other part of the body. However, primarily my surgical practice is focused on the face. I think a few things that separate our practice is that we're very specialized and focused. We take a great amount of time to customize treatment programs for our patients, and comfort and safety is our primary concern in our practice. We perform a great deal of skin resurfacing procedures. We feel that the newer modalities such as the fractional resurfacing laser offers a significant advantage in terms of healing time, which is significantly reduced. We get the benefits of skin tightening with fractional resurfacing without the downtime of the older lasers.
First part here is the DeepFX, which goes a little bit deeper. Working on trying to get some of the crow's feet. So what we're going to be doing is we're going to be using the deep handpiece to come around the crow's feet area like this, and we'll also be going around the perioral area, upper lip. We'll actually come a little bit onto her cheek because we have some deeper wrinkles out in the cheek area, down onto the chin, lower lip.
The differences between the ActiveFX and the DeepFX are fairly profound. The DeepFX offers us the ability to treat the deeper layers of the skin, or what we call the superficial dermis, which is where most of the collagen lies, and the collagen is critical for us to get skin tightening. The ActiveFX handpiece is a more superficial modality, which we're able to take care of superficial fine lines as well as pigmentation without the need to go deeper to get as much collagen and skin tightening. So when you combine both modalities, the ActiveFX and the DeepFX, to give what we term total FX, we get the benefits of both. We can take care of the sun damage and pigmentation with the ActiveFX. We can achieve skin tightening, wrinkle reduction with the DeepFX. The amount of downtime with fractional resurfacing is significantly less than what we used to have with traditional CO2 resurfacing. We've cut it down to about a third of what it used to be. We will tell a patient 5 to 7 days of social downtime compared to several weeks or even months previously with the older modalities. The fractionated or pixelated laser technology of today leaves bridges of untreated tissue. We like to talk to the patient about the fact that we're using columns of laser light, and in between each column there is a bridge of tissue which is not treated. That bridge of untreated tissue actually sends out very powerful healing factors to the areas that have been treated. This leads to significantly less downtime. Okay? The downtime that's involved with fractional resurfacing basically comes from starting with several hours after the procedure where we have an intense feeling of heat, almost like a very profound sunburn. And we found that using whatever modality we can to keep the patient comfortable during this time significantly helps, both in their comfort as well as the healing. Beyond that, we run through a period where the skin is intensely red. We can get some bronzing. Eventually that skin will slough kind of like a snake shedding its skin. When that happens, we then see the pink, newer, fresh tissue and tightened skin that we're trying to achieve. We do see swelling with fractional resurfacing, especially when we use the DeepFX modality. Because we're going to the deeper layers of the skin to try to achieve that tightening, we're going to get a more profound swelling. Because in that area, in those deeper layers of the skin, we're going to have a much more intense inflammatory response rather than the ActiveFX, which is more superficial. So we do find more swelling when we use the DeepFX modality. We have a lot of experience with the AqueCool, especially with our surgical facelift patients. And what we found is immediately they describe a lot of comfort, and it's a very soothing treatment that we're able to offer. Further down the road, we noticed that the time to healing, the amount of bruising in our surgical patient has been significantly reduced. After the fractional resurfacing, using the AqueCool, our patient immediately said that the intense feeling of heat and burning was subsiding as soon as we put the mask on. Well, we know using a cooling therapy during a healing process minimizes the inflammatory response. So we will expect significantly less swelling, significantly less pain, and a faster time to healing. We've been very happy with the AqueCool device. Our patients are quite comfortable. It's very safe and it's easy to use, and ultimately it definitely speeds the healing process. When we describe the comfort that it provides and the improvement in downtime or healing time, most patients are quite receptive to the treatment. Its safety is number one. Number two, the patient comfort. And very closely, number three is going to be the time that it reduces the healing process. So a much quicker recovery is ideal for every patient that we see. I think patients are most intrigued and satisfied with the AqueCool in that the comfort and cooling that it provides. I'd recommend other doctors take a serious look at the AqueCool because of the comfort that it provides the patient immediately after either a surgical or laser resurfacing procedure. I think that the amount of downtime that it decreases during the healing process is significant, and it's a very safe and very user-friendly device for patients to use. We do see a lot of patients who come from out of our immediate area. We have the ability to provide a post-treatment care program at our facility here in Palo Alto. We have partnered with the Four Seasons Hotel that we're able to offer them a few nights stay as well as some spa treatments during the healing process. And as with many of our treatments, whatever we can do to ease the healing time and to promote a more relaxed, stress-free environment, we're very pleased to do so, and our patients are very happy with those treatment options. We are headquartered here in Palo Alto, California. We have offices also in the East Bay in the San Ramon area and in the North Bay in the Santa Rosa area.